Let's chat about something that barely anyone ever mentions on probably one of the most heart-wrenching conditions, recurrent pregnancy loss. I have done probably thousands of consultations over the years, and a number of those patients include patients that have had recurrent miscarriages. And what always shocks me is when patients have gone through this process, if they've gotten investigations done into what the cause of the miscarriage is, because we often see a lot of patients that are kind of brushed off like, it's just bad luck, keep trying. And I tell them, the chances of you having 2 to 3 consecutive miscarriages just because of chance is actually less than 1%. So it's really minimizing a very plausible health condition, and it definitely merits proper investigation, care, and clinical recommendations on what can be done to help reduce that risk of miscarriage for a future and hopefully healthy pregnancy. What's worse is when patients, even if they get that investigation done, in my years of experience, very rarely is there any investigation offered whatsoever for the partner. And sperm health, we know, is a very well-established cause of recurrent miscarriages, especially if they're occurring in the first few weeks of pregnancy, early pregnancy, and the first trimester. So why is this not being looked at? We're seeing research that has established poor DNA integrity, or alternatively called DNA fragmentation in the sperm cells, as a very potential cause and very big risk factor for increased elevated risk of miscarriage. And there was a new research study published very recently in the Journal of Fertility and Sterility. And they found if they gave couples that had recurrent miscarriages, if they gave the male partner or the partner providing the sperm sample 600 milligrams of a particular nutrient, in this study they used alpha lipoic acid, they found that after 80 days of treatment, they saw a decrease in the oxidative stress of the seminal fluid. And oxidative stress is that chemical stress that is mainly implicated in poor DNA integrity for the male partner, or the partner providing the sperm sample. And they saw a reduction in the damage to the DNA strands as well in the sperm cell. And they found that the chance of a spontaneous pregnancy was double compared to patients that received placebo for 80 days. And here we're just talking about one nutrient, right? Like, this is a very small intervention, and that one nutrient in general has a very high safety profile. It has risk of certain side effects, and we'll talk about what those are. But I mean, we're just talking about one tiny ingredient. And in 80 days, potentially a doubling of the spontaneous pregnancy rate and reduction in the damage to the DNA in the sperm cell. So this is like the tip of the iceberg, where we're just kind of scratching, in this video, things that can be done on the sperm health side to really support fertility care and really to help reduce the chances of a miscarriage. And I always tell patients, when it comes to natural health products, there in general can be a very good safety profile, but nothing is free from any side effects. Alpha lipoic acid, even though it is fairly safe, may increase the risk of having insomnia. It can contribute to fatigue, digestive issues, skin rashes. For diabetics, we're very cautious because it can lower the blood sugar. So it needs to be used under medical supervision, and we would never recommend alpha lipoic acid, or ALA for short, on its own. We always look at that in combination with other interventions that have good research or better research as well, and a good safety profile to help treat the cause of the recurrent miscarriages. So, and the other thing here is we can't just give this type of treatment to anyone or everyone. There needs to be a proper investigation into what are the actual risk factors for these recurrent pregnancy losses. So sometimes it's related to oxidative stress, DNA integrity. It can be related to other hormonal issues, thyroid issues, luteal phase defect with progesterone issues, endometriosis, anatomical issues if there's fibroids, polyps, etc. There's a lot of other causes there, and sometimes it's unfortunately what we call an aneuploid pregnancy, where the number of chromosomes is more than 46 or less than 46, and the likelihood of that leading to a miscarriage is fairly high. So there are a multitude of risk factors here, but when we're talking about underlying issues, oxidative stress in the seminal fluid is actually quite common, and we see this very often. So there needs to be a proper investigation done for both partners and treatment. The very few patients that I've seen that were actually diagnosed with having DNA integrity issues on the sperm health side, barely any of them got any recommendations on how to help treat this. So there needs to be a proper consultation and treatment, and this is absolutely necessary because in my observations over the years, the weight and burden of dealing with recurrent pregnancy loss is unfairly shared among the partners, and it's very, very heavily weighted on one partner rather than the other. And this needs to be shared because fertility is a collective outcome, and it requires a collective effort and treatment to address all of the underlying risk factors. So alpha lipoic acid is one of these things that have been studied. And there are other risk factors that need to be discussed as well: lifestyle interventions, dietary interventions, avoiding, like, there's new research coming out looking at even exposure to secondhand smoke and other environmental contaminants and how that can contribute to the risk of infertility for patients trying to conceive and struggling to get pregnant. So, there's so many other things to discuss beyond the scope of what I can share in just one video, and we talk about them in our series of videos that we publish on a regular basis here, sharing summaries of new clinical trials and important evidence to help bring awareness to these topics. But this is something that, I just don't think we can sit around and kind of wait for someone to mention anymore. So if you're dealing with recurrent pregnancy loss, recurrent miscarriages, it's something you're going to have to advocate for in the majority of cases to make sure the partner has proper treatment and assessment and guidance on how to help reduce the risk of another pregnancy loss. Otherwise, we see patients all the time. They just, they're told there's nothing they can identify in what's causing this. They should just keep trying and keep trying and keep trying. And so that's a very big emotional toll that patients would have to suffer through just waiting for something to happen. And anything we can recommend to help reduce the chances of a miscarriage is worth discussing.